I'm Bob Greenspan and welcome to my sixth video. The subject of this one is a look at selected women's medical conditions over the years. This video is a special one for me since 25 years ago I first decided to write a book on medical history, and these videos are an outgrowth of that decision. In 1836, Johann Diefenbach vividly described the misery suffered by women afflicted with a vesiculovaginal fistula, and for the first time I really understood. From then on, rather than recite the usual names and dates, I developed a more personal and realistic approach to the past. More about that condition later, but these videos are a poor man's time machine to meet important and interesting physicians and patients. I'll start by pointing out how women have always been neglected and misunderstood. From the earliest medical records, the mother's role in reproduction was felt to be a passive one. You are looking at a 16th century Leonardo da Vinci sketch in which he perpetuated that view by drawing a direct anatomic relationship between the male reproductive organs and his brain and heart. In reality, of course, there is no such connection, but da Vinci's drawing reflected a pervasive view that the child was made up only of elements from the male. That anatomic representation was consistent with the theory introduced later in the 17th century, which suggested that a totally preformed individual called a homunculus was produced in the male seminal fluid and then transmitted to the female, with the woman only acting as an incubator. That passive view of women's roles was a reflection of the way in which the sexes then interacted on a social level for centuries. Before I go further, I'd like to mention the woman you are looking at now. Against great odds, Elizabeth Blackwell became the first woman to receive a medical degree in America when she graduated from New York's Geneva Medical College in 1847. She spent the rest of her life creating opportunities for others to follow in her path. And of course, I can't forget to mention Florence Nightingale, who was recognized as the founder of modern nursing with the professional procedures and standards she created during the Crimean War. Her 1859 Notes on Nursing is a classic and was the first of its kind. I might personally add that as a practicing physician for almost 50 years, no one admires and respects the work of nurses more than I. The two women I just mentioned were able to overcome centuries of discrimination, but prejudices continued into the 19th century. Following is an illustration from the 1822 Nouvelle Démonstration d'accouchements by J.P. Maguire on the way to discreetly examine a female patient, accompanied by Charles Meigs' early 19th century description.
There are women who prefer to suffer the extremity of danger and pain rather than waive those scruples of delicacy which prevent their maladies from being explored.
You are looking at an instrument called a repositor. It was manufactured by Sharp and Smith in the 19th century with its purpose to reposition the uterus. The term hysteria originates from the Greek word hystera, meaning uterus. Greek physicians, including the father of medicine Hippocrates, believed that movement of the uterus was responsible for any number of observations, including hysterical behavior. The purpose of this instrument was to correct the problem of a, quote, wandering womb by changing its location. This very rare instrument is an 18th century uterine polyp extractor. It was designed by Scottish surgeon John Hunter. During World War II, the British hid his collection of instruments, but despite that, the Germans bombed and destroyed that collection, with this the only remaining example. I'm introducing you to Dr. Hunter because he is considered by many to be the greatest modern surgeon. Regarding obstetrical anatomy, he described the maternal and fetal circulations, but more importantly, he introduced observation and unbiased investigation into surgery, elevating that specialty to a science. His house was divided into two areas, one where he routinely carried on his practice, and the other where he accumulated anatomic specimens and carried on various experiments. The Hunterian Museum is a place to visit in London, but be aware that it was John Hunter who inspired Robert Louis Stevenson to write his famous novel, The Strange Case of Dr. Jekyll and Mr. Hyde. Dominique Jean Larrey was the famous French surgeon to Napoleon. In 1811, Fanny Bryce gave us her chilling personal account of undergoing a mastectomy performed by Dr. Larry before the advent of anesthesia.
Monsignor Dubois acted as commander-in-chief. Dr. Larry kept out of sight. Monsignor Dubois ordered a bed into the middle of the room. Astonished, I turned to Dr. Larry, who had promised that an armchair would suffice, but he hung his head and would not look at me. I stood suspended for a moment, whether I should not abruptly escape. I looked at the door, the windows. I felt desperate, but it was only for a moment. My reason then took the command and my fears and feelings struggled vainly against it. I knew not, positively, then, the immediate danger, but everything convinced me danger was hovering about me, and Monsignor Dubois placed me upon the mattress and spread a cambric handkerchief upon my face. It was transparent, however, and I saw through it that the bedstead was instantly surrounded by 7 men and my nurse. I refused to be held, but when bright through the cambric I saw the glitter of polished steel, I closed my eyes. I would not trust to convulsive fear the sight of the terrible incision, yet when the dreadful steel was plunged into the breast, cutting through veins, arteries, flesh, nerves, I needed no injunctions not to restrain my cries. I began a scream that lasted unintermittingly during the whole time of the incision, and I almost marvel that it rings not in my ears still, so excruciating was the agony. When the wound was made and the instrument was withdrawn, the pain seemed undiminished, for the air that suddenly rushed into those delicate parts felt like a mass of minute but sharp and forked poniards that were tearing the edges of the wound. But when again I felt the instrument, describing a curve, cutting against the grain, if I may so say, while the flesh resisted in a manner so forcible as to oppose and tire the hand of the operator, who was forced to change from the right to the left. Then, indeed, I thought I must have expired. I attempted no more to open my eyes, they felt as if hermetically shut. The instrument this second time withdrawn, I concluded the operation was over. Oh no. Presently the terrible cutting was renewed, and worse than ever, to separate the bottom, the foundation of this dreadful gland, from the parts to which it adhered. Yet again all was not over. I then felt the knife tackling against the breastbone, scraping it. This performed while I yet remained in utterly speechless torture. When all was done and they lifted me up that I might be put to bed, my strength was so totally annihilated that I was obliged to be carried and could not even sustain my hands and arms, which hung as if I had been lifeless, while my face, as the nurse has told me, was utterly colorless. This removal made me open my eyes, and I then saw my good Dr. Larry, pale nearly as myself, his face streaked with blood, its expression depicting grief, apprehension, and almost horror.
John Hunter's older brother, William, was an equally important physician in the history of medicine. You are looking at an image from his 1774 Anatomiae Uteri Humanae Gravidi. He was the foremost obstetrician of that era, and his collections make up a significant part of the Hunterian Museum. You are looking at an early African birthing chair. Any discussion of the history of pregnancy and delivery needs to start in Africa, where giving birth had religious connotations, and members of the community provided emotional and physical assistance during the delivery process. Without the availability of anesthesia or surgical intervention, prior to the 17th century, only the most uncomplicated deliveries were successful. The mother was actually left to her own devices, though sometimes help came from a female assistant or a midwife. Physicians, who were always male, remained reluctant to become involved, and in fact were prohibited from viewing the birthing process until the 16th century. In 1522, Dr. Wirth had to dress as a woman in Hamburg, Germany, in order to witness several deliveries, and when found out, he was burned at the stake. Over the centuries, the role of the midwife changed from simply that of an assistant to a more active one, in which she actually aided in the delivery. William Smellie was an important 18th century obstetrician who is sometimes referred to as the father of British midwifery. Listen to his account of an incident requiring his assistance, as you see a 1513 image by Eucharius Roslin in his A Rose Garden for Expectant Women and Midwives.
A midwife, though she can hardly be supposed mistress of all these qualifications, ought to be a decent, sensible woman of a middle age, able to bear fatigue. She ought to be perfectly well instructed with regard to the bones of the pelvis, with all the contained parts, comprehending those that are subservient to generation. She ought to be well skilled in the method of touching pregnant women, and know in what manner the womb stretches, together with the situation of all the abdominal viscera. She ought to be perfectly mistress of the art of examination in time of labor, together with all the different kinds of labor and the methods of delivering the placenta.
She ought to live in friendship with other women of the same profession, contending with them in nothing but in knowledge, sobriety, diligence, and patience. She ought to avoid all reflections upon men practitioners, and when she finds herself difficulted, candidly have recourse to their assistance. On the other hand, this confidence ought to be encouraged by the man who called, instead of openly condemning her method of practice, even though it should be erroneous, ought to make allowance for the weakness of the sex, and rectify what is amiss without exposing her mistakes. This conduct will as effectually conduce to the welfare of the patient, and operate as a silent rebuke upon the conviction of the midwife who, finding herself treated so tenderly, will be more apt to call for necessary assistance on future occasions, and to consider the accoucheur as a man of honor and a real friend. These gentle methods will prevent the mutual calumny and abuse which too often prevail among the male and female practitioners, and redound to the advantage of both, for no accoucheur is so perfect but that he may err sometimes, and on such occasions he must expect to meet with retaliation from those midwives whom he may have roughly used. 1724. Winston, a midwife who never had any education, and who had formerly vaunted that she always did her own work, and would never call in a man to her assistance, was called to a case in which the child presented wrong. After she had, with great difficulty, brought down the body, she could not deliver the head, from the woman's being of a small size and the child large. During the time of her making these trials, the husband sent in a great haste for me. In the meantime, when the midwife found that her endeavors were in vain, she rested to recover from her fatigue, and told those who were present that she would not wait for the assistance of the woman's pains. One of the servants, seeing me at a distance, went in a hurry, and told her I was come. She, not knowing that I was called, fell to work immediately, and pulled at the child with great force and violence. Finding, as she imagined, the child coming along, she called out that now she had got the better of him. The neck at that instant separating, the body was pulled from the head, and she fell down on the floor. As she attempted to rise, one of the assistants told her that it wanted a head, a circumstance that shocked her so much, being a woman of violent disposition, that she was immediately seized with faintings and convulsions, and obliged to be put to bed in another room. I just then arrived, and was surprised to find the house in such confusion. After being informed of what had happened, I found that the woman's pulse was pretty good, and that there had been no discharge of blood from the uterus, but what came now was only from the child's head, which, to my great joy, I found lying in the vagina and pelvis. I let her lie a little, to recover of the former fatigue, then examining more particularly, I found part of the skin of the neck without the os externum. After I had put her in a supine position, I introduced the fingers of my left hand, and found the mouth at the right side and lower part of the sacrum. Introducing 2 of my fingers into it, I tried with that hold to bring along the head, but finding that this would not be sufficient, and being afraid that the underjaw would separate if I used greater force, I pushed up my fingers farther and along the face, and with my right hand introduced the crochet to the upper part of the forehead. Here I fixed it, and again taking the former hold in the mouth with my fingers, by pulling with them and the crochet, I delivered the head much easier than I expected. After having extracted the placenta, and put the woman into an easier position in bed, I went and recovered the midwife, by giving her some volatile spirits in water. The child appeared to have been dead several days, and I was persuaded that if the neck had not give way, but had stood another pull, the head had been delivered. This accident was lucky for me, and rendered the midwife more tractable for the future.
Malposition of the fetus presented the most serious danger to the lives of both the fetus and the mother. You are looking at an image of podalic version or turning of the foot in the 1844 edition of A Practical Treatise on Midwifery by F.J. Moreau. The great 16th century French surgeon Ambroise Paré brought back ancient Greek physician Soranus' innovation of this procedure and finally legitimized the practice of obstetrics when he established the first school for midwives at the Hotel Dieu in Paris. Earlier, there was nothing that could be done to aid in delivery, so the adoption of podalic version by male physicians marked the birth of the specialty of obstetrics. Following is a 1649 translation by Thomas Johnson of Ambrose Paré's account of, quote, the surgical extraction of the child from the womb, either dead or alive.
Therefore, first of all, the air of the chamber must be made temperate, so that it may neither be too hot nor too cold. Then she must be aptly placed with her buttocks somewhat high, having a hard stuffed pillow under them, so that she may be in a mean figure of situation, neither fitting altogether upright, nor altogether lying along on her back, for so she may rest quietly, and draw her breath with ease, neither shall the ligaments of the womb be extended so as they would if she lay upright on her back. Her heels must be drawn up close to her buttocks, and they are bound with broad and soft linen rowlers. The rowler must first come about her neck, and then crosswise over her shoulders, and so to the feet, and there it must cross again, and so be rowled about the legs' thighs, and then it must be brought up to the neck again, and there made fast, so that she may not be able to move herself, even as one should be tied when he is to be cut of the stone. But that she may not be wearied, or lest that her body should yield or sink down, as the surgeon draweth the body of the infant from her, and so hinder the work, and then let some of the standers by hold her fast by the legs and shoulders, then that the air may not enter into the womb, and that the work may be done with the more decency, her privy parts and thighs must be covered with a warm double linen cloth. Then must the surgeon, having his nails closely pared, and his rings, if he wear any, drawn off his fingers, and his arms naked, bare, and well anointed with oil, gently draw the flaps of the neck of the womb asunder, and then let him put his hand gently into the mouth of the womb, having first made it gentle and slippery with much oil, and when his hand is in, let him find out the form and situation of the child, whether it be one or two, or whether it be a mole or not. And when he findeth that he cometh naturally, with his head toward the mouth or orifice of the womb, he must live him up gently, and so turn him that his feet may come forwards, and when he hath brought his feet forwards, he must draw one of them gently out at the neck of the womb, and then he must bind it with some broad and soft or silken band a little above the heel, with an indifferent slick knot, and when he hath so bound it, he must put it up again into the womb, then he must put his hand in again, and find out the other foot, and draw it also out of the womb, and when it is out of the womb, let him draw out the other again whereunto he had before tied the one end of the band, and when he hath them both out, let him join them both close together, and so by little and little let him draw all the whole body from the womb. Also other women or midwives may help the endeavour of the surgeon, by pressing the patient's belly with their hands downwards as the infant goeth out, and the woman herself by holding her breath, and closing her mouth and nostrils, and by driving her breath downwards with great violence, may very much help the expulsion.
One of the most important discoveries in the history of medicine was that of the obstetric forceps. A variant of the type used today was available to physicians in the Middle East in 1008, though that knowledge was lost for centuries until rediscovered by Peter Chamberlain in the 17th century. Chamberlain was a barber surgeon and had two sons named Peter the Elder and the Younger, both of whom practiced obstetrics. The elder was probably the inventor of the modern obstetric forceps and was the barber surgeon to Queen Anne, wife of King James I. Unfortunately, the good doctor elected to keep his life-saving discovery a family secret, thus transforming this into a story of power, fame, and greed. When delivering a child, Chamberlain mysteriously brought a large ornate box into the operating room that was carried by two assistants and covered with a black cloth. He performed his deliveries under a sheet and kept his discovery within his family, where it stayed for generations. After a fascinating story of deception and intrigue, another Chamberlain moved to Essex, where in 1683 his widow buried the secret forceps under a trapdoor in the attic. In 1813, a wine merchant bought the estate and discovered the instruments, which he then donated to the Royal College of Obstetrics and Gynecologists, where they reside today. The story was recounted in 1862 by H. Carwardine.
2 or 3 years ago, a lady with whom I am intimately acquainted, and from whom I had the particulars, discovered in the floor of the upper closet a hinge, and tracing the line she saw another, which led to the obvious conclusion of a door. This door she soon found means to open. There was a considerable space between the floor and the ceiling below, and this vacancy contained divers empty boxes, etc. Among these was a curious chest or cabinet, in which was deposited a collection of old coins, trinkets, gloves, fans, spectacles, etc., with many letters from Dr. Chamberlain to different members of his family, and also the obstetric instruments. Being on terms of intimacy with the family resident at Woodham Mortimer Hall, These instruments have been presented to me, and I have now the gratification of depositing them with your society for the gratification of public curiosity, and to secure to Chamberlain the need of posthumous fame due to him for his most useful discovery.
Carrying a pregnancy to term has always been a risky undertaking, both for the lives of the child and the mother, because of anatomic incompatibilities that did not allow the fetus to pass easily. The cesarean section was an operation performed prior to the 19th century, but only to save the life of the fetus when the mother was either dead or dying. In legend, the Greek god Apollo performed the first cesarean section when he delivered his son Asclepius, the eventual god of medicine. The term has been attributed to the birth of Julius Caesar, though this origin is likely erroneous since Caesar's mother, Aurelia, was apparently alive during her son's invasion of Great Britain years later. The term may have originated from the Latin term caedere, which means to cut, or perhaps it's related to the laws enacted under Roman emperors called Caesarean laws. There was little understanding of the relevant anatomy and physiology since in 1280 the Council of Colonia passed a decree that on the death of the mother while in labor, her mouth was to be kept open so that the baby would not suffocate prior to being removed by cesarean section. It was not until 1500 that the first documented procedure took place on a living woman in Switzerland. Jacob Neuffer delivered his own child while 13 midwives had assisted the mother for days without success. With permission from the authorities, Neuffer successfully performed the operation. The baby lived to the age of 77, and his wife went on to have 5 more children. Abortion always has been and always will be a controversial subject. At least officially, that procedure was to be performed only to save the life of the mother. The determination of fetal demise was obviously a difficult one to make. Here, 18th century Dutch physician Herman Boerhaave gave some guidance.
'Tis known to be dead, if it is unmovable, if the umbilical arteries are felt to rest upon the navel string, and chiefly near the body of the child, if there comes from the womb fetid matters, if the mother feels a greater dead weight than a little while before, if she has sudden and continual motions to go to stool, if she faints away often, her hairs stand on end, her breath stinks much, and of a dead core, looks of a livid colour, if she is not delivered long after the waters are all come away, if the skin of the child feels loose, and comes off easily, and his bones are movable and soft.
This was British Lord Ellenborough's 1803 Act making abortion illegal.
Be it therefore further enacted that if any person or persons shall wilfully and maliciously administer to, or cause to be administered to, or taken by any woman, any medicines, drug, or other substance or thing whatsoever, or shall use or employ, or cause or procure to be used or employed, any instrument or other means whatsoever, with intent thereby to cause or procure the miscarriage of any woman not being, or not being proved to be, quick with child at the time of administering such things, or using such means, that then and in every such case the person or persons so offending, their counsellors, aiders, and abettors, knowing of and privy to such offence, shall be and are hereby declared to be guilty of felony, and shall be liable to be fined, imprisoned, set in and upon the pillory, publicly or privately whipped, or to suffer one or more of the said punishments, or to be transported beyond the seas for any term not exceeding 14 years, at the discretion of the court, before which such offender shall be tried and convicted.
You are looking at a 19th century guarded crochet manufactured by W.B. Milliard. Its use will then be described by Dr. William Smaley, while you see an illustration taken from the 1836 Principles and Practice of Obstetric Medicine by David Davis.
When all the common methods have been used without success, the woman being exhausted and all her efforts vain, and when the child cannot be delivered without such force as will endanger the life of the mother, because the head is too large or the pelvis too narrow, it then becomes absolutely necessary to open the head and extract with the hand forceps or crochet. Indeed, this last method formerly was the common practice when the child could not be easily turned, and is still in use with those who do not know how to save the child by delivering with the forceps. For this reason, their chief care and study was to distinguish whether the fetus was dead or alive, and as the signs were uncertain, the operation was often delayed until the woman was in a most imminent danger, or when it was performed sooner, the operator was frequently accused of rashness, on the supposition that the child might in time have been delivered alive by the labor pains, when the head presents, and such is the case that the child can neither be delivered by turning nor extracted with the forceps, and it is absolutely necessary to deliver the woman to save her life. This operation must then be performed in the following manner. The operator must be provided with a pair of curved crochets together with a pair of scissors about 9 inches long, with rests near the middle of the blades and the blunt hook. The patient ought to be laid on her back in the same position in the use of the forceps. The operator must be seated on a low chair, and the instruments concealed. Let him introduce his hand and press 2 fingers against one of the sutures of the cranium, then take out his scissors from the place in which they were deposited and guiding them by the hand and fingers till they reach the hairy scalp, then push them gradually into it until their progress is stopped by the rests. Let them be kept firm in that situation, and the hand that was in the vagina being withdrawn, the operator must take hold of the handles with each hand and pull, and sufficient room made for the introduction of the fingers. This operation being performed, let the scissors be shut and withdrawn. But if this instrument will not answer the last purpose, the business may be done by introducing the crochet within the opening of the skull. Let him introduce his right hand into the vagina, and 2 fingers into the opening which hath been made, that if any sharp splinters of the bones remain, they may be broken off and taken out, lest they should injure the woman's vagina, or the operator's own fingers. Although many people have exclaimed against the crochets as dangerous instruments from ignorance, want of experience, or a worse principle, as formerly observed, yet I can assure the reader that I never either tore or hurt the parts of a woman with that instrument. I have indeed several times hurt the inside of my hand by their giving way, and before we had the curved crochet, I have been so fatigued from the straight kind slipping their small holes so often, that I have scarcely been able to move my fingers or arms for many hours after, and if this force had not been used, the mother must have been lost as well as the child.
Mid-19th century Hungarian obstetrician Ignaz Semmelweis made one of the most important discoveries in the history of medicine when he recognized the role that physician-spread infection played in the deaths of thousands of postpartum women. The condition was called childbed or puerperal fever and usually presented 4 days after delivery with chills, fever, and almost certain death. In the obstetrics department at the University of Vienna, students performed physical examinations on their patients immediately after having come from the dissecting room. Professors and students did not wash their hands, and the postpartum death rate was up to 30%. Professor Jakob Kolechka had been greatly admired by Semmelweis during his stay at the hospital, but unexpectedly died while he was away. Following Semmelweis' report of his discovery, along with his unsuccessful efforts to change the behavior of his colleagues. The first picture is of Dr. Semmelweis, with that report followed by a pathologic image of puerperal fever, and lastly, one of the offenders, Professor Friedrich Scanzoni.
Kolechka, professor of forensic medicine, often conducted autopsies for legal purposes in the company of students. During one such exercise, his finger was pricked by a student with the same knife that was being used in the autopsy. I do not recall which finger was cut. Professor Kolechka contracted lymphangitis and phlebitis in the upper extremity. Then, while I was still in Venice, he died of bilateral pleurisy, pericarditis, peritonitis, and meningitis. A few days before he died, a metastasis also formed in one eye. I was still animated by the art treasures of Venice, but the news of Kolechka's death agitated me still more. In this excited condition I could clearly see that the disease from which Kolechka died was identical to that from which so many maternity patients died. Earlier, I pointed out that autopsies of the newborn disclosed results identical to those obtained in autopsies of patients dying from childbed fever. I concluded that the newborn died of childbed fever, or in other words, that they died from the same disease as the maternity patients. Since the identical results were found in Kolechka's autopsy, the inference that Kolechka died from the same disease was confirmed. The exciting cause of Professor Kolechka's death was known. It was the wound by the autopsy knife that had been contaminated by cadaverous particles. Not the wound, but contamination of the wound by the cadaverous particles caused the death. Kilichka was not the first to have died this way. I was forced to admit that if his disease was identical with the disease that killed so many maternity patients, then it must have originated from the same cause that brought it on in Kilichka. In Kilichka, the specific causal factor was the cadaverous particles that were introduced into his vascular system. I was compelled to ask whether cadaverous particles had been introduced into the vascular systems of those patients whom I had seen die of this identical disease. I was forced to answer affirmatively. Because of the anatomical orientation of the Viennese Medical School, professors, assistants, and students have frequent opportunity to contact cadavers. Ordinary washing with soap is not sufficient to remove all adhering cadaverous particles. This is proven by the cadaverous smell that the hands retain for a longer or shorter time. In the examination of pregnant or delivering maternity patients, the hands, contaminated with cadaverous particles, are brought into contact with the genitals of these individuals, creating the possibility of absorption. With reception, the cadaverous particles are introduced into the vascular system of the patient. In this way, maternity patients contract the same disease that was found in Kilichka. Suppose cadaverous particles adhering to hands cause the same disease among maternity patients that cadaverous particles adhering to the knife caused in Kilichka. Then if those particles are destroyed chemically, so that in examinations patients are touched by fingers but not by cadaverous particles, the disease must be reduced. This seemed all the more likely, since I knew that when decomposing material is brought into contact with living organisms it may bring on decomposition. Your teaching, Herr Hofrath, is based on dead bodies of lying in women slaughtered through ignorance, and because I have formed the unshakable resolution to put an end to this murderous work as far as lies in my power so to do, I denounce you before God and the world as a murderer, and the history of puerperal fever will not do you an injustice when, for the service of having been the first to oppose my life-saving doctrine, it perpetuates your name as a medical Nero. Should you, Herr Professor, without having disproved my doctrine, continue to train your pupils in the doctrine of epidemic childbed fever, I declare before God and the world that you are a murderer, and the history of childbed fever would not be unjust to you if it memorialized you as a medical Nero in payment for having been the first to set himself against my life-saving doctrine. To you, Herr Professor, there remains nothing else but to adopt my doctrine, if you still want to salvage something of your reputation, whatever of it is still left to salvage. Herr Professor has proven that in spite of a new lying-in hospital, furnished with the best equipment, a great deal of homicide can be committed, if only one possesses the necessary talents.
You are looking at a statue erected in honor of Dr. Semmelweis that is now standing in Budapest. As you can deduce by the previous communications, he unfortunately was not a good politician, particularly in Vienna, since his native language was Hungarian. Semmelweis faced constant battles with his peers and never got the credit he deserved while he was alive. In 1863, he was declared insane by 3 physicians who were not qualified as psychiatrists and was sent to a mental hospital in Vienna. Accounts vary, though some attribute Semmelweis's unusual behavior to an early syphilitic infection. While institutionalized, he was reportedly beaten by attendants and ironically died from an infection that developed as a result of wounds that were inadequately treated. Even when a delivery was uneventful, potentially devastating consequences awaited the mother. A vesiculovaginal fistula is an age-old complication that was first described in the Kahun Egyptian papyrus. That fistula is a connection between the bladder and the vagina, which forms as a result of a difficult labor that could last several days. Prolonged pressure of the fetal head on the delicate walls of the vagina, the bladder, and the rectum can cause tissue necrosis, resulting in the development of a connection between the 3, leading to incontinence of urine and stool. I mentioned at the beginning of this video that reading Johann Diefenbach's 1836 vivid description of this dreadful condition 25 years ago inspired me to write a book on medical history, which then resulted in my recording these videos.
A sadder situation can hardly exist than that of a woman afflicted with a vesicovaginal fistula. A source of disgust, even to herself, the woman beloved by her husband becomes, in this condition, the object of bodily revulsion to him, and filled with repugnance, everyone else likewise turns his back, repulsed by the intolerable, foul, uriniferous odor. As a result of the seepage from the opening, whether large or small, the usual retention of the urine in the vaginal folds makes it even sharper and more pungent. The labia, perineum, lower part of the buttocks, and inner aspect of the thighs and calves are continually wet, to the very feet. The skin assumes a fiery red color and is covered in places with a pustular eruption. Intolerable burning and itching torment the patients, who are driven to frequent scratching to the point of bleeding, as a result of which their suffering increases still more. In desperation many tear the hair, which is coated at times with a calcareous urinary precipitate, from the mons pubis. The refreshment of a change of clothing provides no relief, because the clean undergarment, after being quickly saturated, slaps against the patients, flopping against their wet thighs as they walk, sloshing in their wet shoes as though they were wading through a swamp. The bed does not suit them, because a good resting place, a bed or a horsehair mattress, is quickly impregnated with urine and gives off the most unbearable stench. Even the richest are usually condemned for life to a straw sack, whose straw must be renewed daily. One's breath is taken away by the bedroom air of these women, and wherever they go they pollute the atmosphere. Washing and anointing do not help, perfumes actually increase the repugnance of the odor, just as foul-tasting things become even worse when coated with sugar. This horrendous evil tears asunder every family bond. The tender mother is rejected from the circle of her children. Confined to her lonely little room, she sits there in the cold, at the open window, on her wooden chair with a hole cut in its seat, and may not cover the floor with a carpet even if she could. Indifference overtakes some of these unfortunates, others give themselves over to quiet resignation and pious devotion. Otherwise they would fall victim to despair and would attempt suicide.
19th century American surgeon James Marion Sims, who is sometimes credited as being the father of modern gynecology, finally found a surgical solution. Sims' discovery came after placing his patient in a knee-chest position, which allowed him to directly visualize the fistula with a specially developed instrument, now called a Sims speculum, made out of a bent pewter soup spoon. Though others had used the Sims position for the repair of vesiculovaginal fistula, his new technique with the inclusion of silver sutures resulted in a worldwide change in the treatment of this devastating condition. You are now looking at an 1882 lithograph by Henry Savage in his Surgical Anatomy. Though Sims eventually served as the president of the American Medical Association and was the founder of the American Gynecological Association, his work is not without controversy, since his first experiments were on his African American slaves, Anarcha, Betsy, and Lucy, reportedly without the use of anesthesia. In his 1884 autobiography, Sims commented with delight, quote, "This was the 13th operation performed on Anarcha. She was put to bed, and the next day the urine came out from the bladder as clear and as limpid as spring water." Next is a very rare vesiculovaginal surgical set containing 2 Sims specula, accompanied by Sims' description of his discovery before the New York Academy of Medicine in 1857.
I cannot, nor is it needful, to describe my emotions when the air rushed in and dilated the vagina to its greatest capacity, whereby its whole surface was seen at one view for the first time by any mortal man. With this sudden flash of light, with the fistulous opening seen in its proper relations, seemingly without any appreciable process of ratiocination, all the principles of the operation were presented to my mind, and thus in a moment, in the twinkling of an eye, new hopes and new aspirations filled my soul, for a flood of dazzling light had suddenly burst upon my enraptured vision, and I saw in the distance the great and glorious triumph that awaited determined and persevering effort. I thought only of relieving the loveliest of all God's creation of one of the most loathsome maladies that can possibly befall poor human nature. Full of sympathy and enthusiasm, thus all at once I found myself running headlong after every class of sufferers that I had all of my professional life most studiously avoided.
Again, these videos are not intended to be complete academic reviews, but only a unique way for you to join me in returning to the past. Hopefully, I'll see you next time.